Mr. Tajuddin Ibrahim. Please, a round of applause for him.
Good afternoon, sirs. Good afternoon, Ma. The Honorable Coordinating Minister, CCM Chair, the Honorable Minister of State for Health and Social Welfare, the Permanent Secretary, Minister of Health and Social Welfare, the DG NACA, the representative of the Global Fund country team, national coordinators, the CEO from implementing partner, as well as development partners, ladies and gentlemen, permit me also to ride on the already established protocol. On behalf of the leadership of CCM, I bring greetings, and I'm here to inform us of the decision already taken by the CCM, considering the fact that we recognize the importance of HIV and TB collaboration. In the last 8 years, Nigeria CCM has decided to write joint HIV and TB funding application, and that is what we are currently implementing. So which means the collaboration have started long before now. As we are commemorating the World TB Day, we believe we can end the TB. In addition to that, we are also upped our game in terms of fighting the HIV AIDS as well as tuberculosis together. And that is why we are launching the Lenacapavir, which is considered a game changer. And with that, we are willing to tackle TB and HIV together. No longer HIV or TB, but HIV and TB. Early detection, prompt treatment, and prevention are key to healthier future. Hence, TB and HIV prevention. Thank you.
Mr. Tajuddin Ibrahim establishing the importance of service integration in his comments right here. Thank you so much, sir. We truly appreciate you. I'd like to welcome the next person to deliver a goodwill message. And this is from the Chief Executive Officer of the Institute of Human Virology, Nigeria. Let's welcome Dr. Patrick Daku.
The Honorable Coordinating Minister of Health, Ministry of Health and Social Welfare, the Honorable Minister of State, Ministry of Health and Social Welfare. And then if they had stopped the protocol at that point and said we shouldn't include the Permanent Secretary, for obvious reasons, I would have included it in mine. And so the Permanent Secretary, Ministry of Health and Social Welfare, who is my sister. I'll be very brief. Coordinating Minister, sir, I'm here on behalf of the Institute of Human Virology Nigeria, a principal recipient, and on behalf of all the sub-recipients, and on behalf of other implementing partners that are committed to translating all these nice policies, nice slides into actionable points at the community. Our goal is to ensure that there is speed and efficiency in what the plans are. And we are grateful that especially for your person that we have worked with for the several years that have passed, we know that we have a captain that can steer the boat in the right direction. So I think for the audience, we can answer together. Is it possible for us to prevent and cure TB? If you agree, shout yes. Okay. Now for the Lenacapavir, I will tell a story. And there's a story that spans the past 27, 28 years when we started out on prevention of HIV. And what we were doing was ABC, abstinence, be faithful, condom. And so I was an implementer, and so I'll translate it into actionable points. And I had these traditional rulers, I had religious leaders, and I wanted to talk about condoms. And I didn't know how they will take it. So we now put condoms, and I announced that we have condoms here for anybody who will want to get one or two. And of course, nobody did. The next day I said, put the condoms in the tray that we move around with for tom-tom. And put tom-tom, put cola nut, and put condoms there. By the time the tray came back, I'm sure you know the answer. What was absent in the tray? Mr. Minister, sir, we are able to do it. We are committed to do it. We believe that it's a winnable team that we have with you and the Minister of State for Health. And we will and definitely make it happen. And to the Global Fund, of course, thank you so very much. You know, when you have a reliable person, and in the context of where we are now, reliability of friendship is very key. And I don't need to say more than that. Thank you very much. And of course, we'll continue to work with WHO and the other UNAIDS for us to succeed. Thank you very much, and God bless.
Dr. Dakum left his phone. I thought it was part of the cola nut. And I almost picked it and put it in my pocket. My goodness. Ladies and gentlemen, the CEO, IHVM, please give him a round of applause. Good one there. Good one there. That was beyond a goodwill message. There's a lesson that we learned there. Let's take the next goodwill message, which will be delivered by the Senior Director, Infectious Diseases and Neonatal Health from the Clinton Health Access Initiative, Dr. Chizoba Fashanu. Please encourage her.
Good afternoon and warm greetings. The Honorable Minister of Health, Coordinating Minister of Health and Social Welfare, the Minister of Health for Social Health and Social Welfare, and the Minister of State for Health and Social Welfare, and our very own Permanent Secretary, Ministry of Health and Social Welfare. I will ride on existing protocol. I come on behalf of my country director, Dr. Funke Fashawe, who could not be here, but sends warm greetings from the Clinton Health Access Initiative, CHI. It's a privilege for us to be here in this groundbreaking event and also a historic moment for us. We would first like to commend the Federal Ministry of Health for consistently placing the health of Nigerians front and center. Today's national launch of the multi-accountability, multi-sectoral accountability framework for TB and Lenacapavir is truly, truly, truly a historic moment for us and a demonstration of the commitment, the urgency, vision, and proactiveness with which the ministry has moved to ensure accelerated access towards TB and Lenacapavir. And we don't say that lightly. This is something that we truly believe in and have experienced as we've worked with most of you in the room. This is leadership in action, clear demonstration of leadership in action, and it deserves to be acknowledged, and we acknowledge this. CHI, Clinton Health Access Initiative, CHI, through the support of UNITAID and the Elton John Foundation, is proud to have contributed to making today possible. We are a global organization. We work in Nigeria as well. At the global level, we supported market-shaping efforts to ensure that Lenacapavir was priced comparatively to oral preparations. So we have an injectable that is it's a miracle drug for us. But making sure that it was right priced and accessible was one of the things that we worked very, 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 very strongly at the global level. This included policy, regulation, working with manufacturers. We have also been supporting the TB and leprosy program to expand innovative diagnostics treatments, as well as facilitating access to integrated services. We are taking integrated services, malaria, TB, nutrition, to fragile settings and to the communities. As we prepare for the phased introduction of LEN, and I think this has been said, the DG NACA has spoken to this, I think our colleague from IHVN has said this, I will not belabor it, but collaboration will be key. Government leadership, we will lean into government leadership, donor support, Global Fund, and all the other donors here, community engagement, as well as media participation. And I think we have all of those in the room today. CHAI remains fully committed to supporting Nigeria on this journey through advocacy, technical assistance, which is what we do, and partnership, until the day HIV and TB are no longer in Nigeria. I think we said, can we kick it out? We believe that we can definitely make a significant dent and kick it out. So, to the Ministry of Health, our esteemed partners, and every individual here who has worked tirelessly, and we have worked tirelessly for decades, behind the scenes to bring us to this moment, I want to say thank you. The end of the HIV epidemic and TB as well, we don't think it's an aspiration. We think it is something that we can truly achieve, and we are fully in support. Today, it definitely feels closer than ever. Thank you very much.
Thank you very much, Dr. Chizoba Fashanu from CHAI. You know, in Nigeria, when you say CHAI, it's in two things. It's either for something good or something bad. So CHAI is something good, actually. So a round of applause for CHAI. All right, before we call on our next speaker, I'd like to acknowledge the presence of the Permanent Secretary, Civil Service Commission, Dr. Vitaly Zobi, MNI. Thank you so much for being here. Thank you. And earlier, we skipped to mention these names. The co-chair, World TB Day, Dr. Onyema Enang. Please, a round of applause for that person who is here. And also the vice chair, Dr. Olayemi Olupito. Please, a round of applause. Thank you for being here. All right, we'd like to welcome the representative of Stop TB Partnership Nigeria. Please, a round of applause as she makes her way here. Our sincere apologies, your name was not forwarded to us. But you do us the honors to introduce yourself. Thank you.
Good afternoon, everyone. The Honorable Coordinating Minister of Health and Social Service, Social Welfare, the Minister of State for Health and Social Welfare, the Permanent Secretary, Federal Ministry of Health and Social Welfare. I'm Dr. Queen Oguji. I'm the Board Chair for Stop TB Partnership. It is a privilege to bring this goodwill message on behalf of Stop TB Partnership Nigeria and to congratulate the Honorable Minister as we gather here to commemorate the World TB Day 2026. Today is more than a symbolic observance. Is a reflection, a moment of reflection, accountability, and renewed determination. The World TB Day theme, Yes, We Can End TB, and the slogan, powered by the Federal Ministry of Health, led by the Federal Ministry of Health and powered by community, is both a message of hope and a call to responsibility. It affirms that ending TB in Nigeria is achievable when there is strong government leadership and when the communities are powered to be active drivers of the response. At Stop TB Partnership Nigeria, our mandate remains clear. We are committed to advancing advocacy, strengthening partnerships, and driving domestic resource mobilization as critical pillars to ending TB in Nigeria. In face of declining global health financing, the sustainability of the response depends on the ability of the country to mobilize and efficiently utilize domestic resources. This includes budgetary allocation and release of funds for TB, HIV, and malaria at federal, ministry, state, and local government levels, the involvement of private sector organizations in TB response, and the adoption of innovative financing mechanisms that will generate or guarantee uninterrupted access to quality TB prevention, diagnosis, and treatment services. We are very encouraged by the growing commitment from the government and key stakeholders, which reinforce our confidence that ending TB in Nigeria is within reach. However, this progress must be matched with sustainable funding to protect the gains made and accelerate impact. Let us move beyond promises to decisive action. Let us translate commitments into measurable results, and let us work together to build a country where tuberculosis is no longer a public health threat. Today, Honorable Minister, we know that together, led by the government, empowered by communities, we can end TB in Nigeria. Yes, we can end TB. Thank you, sir, and God bless the Federal Republic of Nigeria.
Thank you very much for your goodwill message. We'd like to move quickly. I'd just like to crave everyone's indulgence because the Federal Ministry of Health, the government of Nigeria recognizes that we can't do this alone. And so it's important that we give this time to our partners and critical stakeholders to lend their voice to this launch today. And so we'd like to recognize the United States government. I'm informed that they're not here, but the Nigerian people appreciate them for their support and their contributions in this light. Please, a round of applause for the USG. I'd like to welcome the country director for UNAIDS, Ms. Tina Bonto. A round of applause for her as she comes up.
Good afternoon, greetings. Your Honorable Minister, Coordinating Minister for Health and Social Welfare, Honorable State Minister for Health and Social Welfare, and the Permanent Secretary. On behalf of the UN Joint Team on AIDS here in Nigeria, I respectfully acknowledge the presence of all dignitaries here. It is truly an exciting day to join the national launch and flag off of the Lenacapavir for HIV prevention here in Nigeria, which is also being commemorated alongside World TB Day. As previous speakers have acknowledged, this is great, and it shows integration and a joint collaborative approach moving forward. Nigeria has been a pioneer, one of the earliest adopters of PrEP, endorsing oral PrEP in 2016. Subsequently expanding and scaling up the program with donor support, as was mentioned, the Global Fund and the US government. Allow me to appreciate the forward-looking national HIV strategic framework that included this critical option early and has laid the foundation to be able to continue with injectable Lenacapavir today. I congratulate Nigeria for today's launch and look forward to providing support of the United Nations Joint Program to facilitate smooth implementation of the rollout plan in the initial 8 states. So much is at stake now, particularly when we are sure that funding is running out and people living with HIV and priority groups are still at risk of HIV infection, and they need continued support and effective solutions to close this HIV prevention gaps. Although the MC has mentioned that there has been magnificent progress on HIV here in Nigeria, we are aware that there is still 48,000 new infections that are occurring each year. That puts Nigeria at one of the countries that are still not able to control the epidemic. So more effort is needed. We hope and pray that this new program will be successful so that it can be taken to scale to be able to avert all new HIV infections and achieve the 0 new infection goals. We appreciate continued support of donors, the Global Fund, the US government, and other development partners in order to continue to overcome the remaining barriers to end AIDS as a public health threat in Nigeria by 2030. Thank you.
Thank you very much, Ms. Tina Bonto. The country director, UNAIDS, please let's appreciate her once again. Thank you. The fight against HIV and AIDS, of course, the mention of discrimination and stigma is something that has lingered, and it's a fight for everybody because no one is expected to be discriminated or stigmatized. And our next speaker is someone who is representing that community that must stand tall. I'm talking about the network of people living with HIV and AIDS in Nigeria. Let's welcome Dr. Abdulkadir Ibrahim.
The Honorable Coordinating Minister for Health, Professor Muhammad Ali Pate, the Honorable Minister for Health for State, the Permanent Secretary. Initially, the Honorable Coordinating Minister, I wanted to seek your permission to acknowledge our new brand executive director for UNAID, Dr. Tina Bonto, but I'm glad that she was invited here to make a speech. As a person living with HIV, we can't be seated where UNAID is not there. Yes, because they represent the voice of people living with HIV and other marginalized groups. And you can acknowledge that she mentioned something about stigma. We need to mention that in what we do. But that is not why I'm here. I want to also use the opportunity to acknowledge everybody present here. Today, we are standing as the big brother from the HIV community to the TB community, and to commemorate the World TB Day 2026. As we all know, TB is one of the leading factor that kills people living with HIV, but it is also important to note that by creating the demand creation for early diagnosis, putting people on treatment, we are sure of preventing the death and also the spread of the disease among our community and the larger community at large. Today, we are also launching the LEN, and it is a good opportunity to say that Nigeria is doing great, and we are happy with this leadership that the government of Nigeria is providing under the leadership of the Honorable Coordinating Minister for Health. And I want to also use this opportunity to appeal to the government that the fight is not yet over, but with all the achievement and also the strike we have had, that ending AIDS and TB is possible. And yes, we can end TB as well. My call to the government is, this one is people like us that can say it, and I have to put it on record. I want to appeal to the government, whatever counterparts, I don't want to mention figure, the minister is smiling. But whatever figure from the government, I want to appeal that we should put it. Maybe it has been settled maybe yesterday, but I'm not sure. But we want to appeal that less government put resources in this, because we've just received allocation letter from the Global Fund amounting to about $790 million US, which is also a big amount that as a country we need to match it with in-country resources. So thank you very much, Global Fund, for this continued support to Nigerian government. For the LEN, we are happy that this is available. Yesterday, immediately after the media parley, I snapped the LEN staff. About 27 people sent in a message to my DM that, hey, Abdul, where can I get this? I even want to buy. So this is a strong message that the long-awaited commodity is available and people are looking forward to it. So I want to appeal that no matter how we want to do as government, we should make it much more available and accessible to people. There are people who have private life, and you can't subject people to eligibility criteria. Either you must be a KP community or a discordant couple to HIV partner or a young person. Other people have their life and they keep it private. So I want to appeal that we should make this much more available to people so that we can be able to prevent this. I want to use this opportunity to thank everybody for coming and giving me the opportunity to stand before you. Thank you, and God bless Nigeria.
The National Coordinator for the Network of People Living with HIV in Nigeria, Mr. Abdulkadir Ibrahim, giving a face to everything that we're doing and moving us here. Please give him another round of applause. Thank you, sir. Thank you for underscoring that LEN is being launched, and LEN is being launched in 8 states in Nigeria: the FCT, Cross River, Kwara, Ebonyi, Anambra, Benue, Gombe, and Akwa Ibom states. That's where it's going to be launched. Let's take another goodwill message. We're almost at the end of these. Well, let me welcome the representative from the KP Secretariat, the Key Population Secretariat, please. Give her a round of applause as she comes. Clap, please, too, please. Please be kind.
Good afternoon, everyone. Standing on existing protocol, my name is Aseme Josephine, and I'm representing Key Population in Nigeria as the chairperson of the Secretariat. For us as Key Population, today is more than a moment, it is a movement for us. And as the first person in Nigeria to take the Lenacapavir, the LEN, for HIV prevention, I stand here with hope and with purpose, because I have been once on oral PrEP. And for us, for many in the communities, daily pill have not always been easy. Stigma, access, and life realities always get in the way each time we want to access services. But we learn, it changes everything. It gives us a choice, a simpler, long-acting option that fits into our lived realities. And that choice for us today matters. Today, I'm not just taking LEN for myself, I am taking it for every young woman and every member of our community who deserves protection without fear or any form of barrier. This is our time to embrace innovation. This is our time to demand access, and this is our time to take control of our health. I encourage everyone out here today to ask questions, seek information, and when it becomes available, please choose what works for you. And to the Honorable Minister, to the government, this is the reality that as Key Population, we exist. And for me, taking the LEN today is a way of encouraging the members of the community who are here today and those outside that LEN is effective, and it's time for us to do what to end HIV new infection in the country. When we say yes, we can end AIDS, and yes, we can end TB today. Thank you.
Thank you very much, Josephine. Please, a round of applause for her again. Thank you. And earlier, His Royal Highness, my co-MC, recognized the 8 states where LEN PrEP will be distributed. But of course, we want to recognize the state coordinators who are here present. Please, a round of applause for them. Well done for the good job you're doing. And I'm made to understand, and I'm privileged to know that LEN PrEP is free. So you were asking people who want to buy. I think the federal government deserves a round of applause. And of course, the partners, you know, the Global Fund, all partners involved in this. Did I let the cat out of the bag? Okay, all right. So I'd like to make welcome our next speakers. You know, the theme for this year for World Tuberculosis Day is Yes, We Can End TB, led by countries and powered by people. So there are people who are survivors of this TB. Let's welcome representative of TB People Network, a representative of the TB People Network. Please, a round of applause. Do we have a representative here? Okay, we appreciate you in spirit, and of course, wherever you are across the country, a round of applause for them. Let's move on to the next speaker. Route to Rise, let's welcome Adobe Olise. She's the Nigeria project lead. Please, a round of applause for her.
Good afternoon, the Honorable Coordinating Minister for Health and Social Welfare, the Honorable Minister for State for Health and Social Welfare, the Permanent Secretary, distinguished ladies and gentlemen, and invited guests here present. I bring you warm congratulations and hearty greetings from our Executive Director, Ashley Vidge. Root to Rise is a new organization that was formed by very passionate global health leaders to ensure that we close the gaps from the funding crisis and to ensure that the new innovations actually reach the people who need them the most. And so it is very exciting and it is a great honor to be standing here today alongside the government of Nigeria to be launching one of the most exciting innovations in HIV prevention, which is Lenacapavir. Today is more than a launch. It's a celebration of vision, it's a celebration of partnerships. We have seen the community speak, we have seen the government speak, we have seen the donors speak, and it's also a celebration of persistence. Introducing LEN amidst a shifting global funding landscape is actually a huge, huge milestone. So let's appreciate the government of Nigeria and all stakeholders involved. On behalf of Root to Rise, I want to sincerely appreciate the government of Nigeria, the Federal Ministry of Health and Social Welfare, the National AIDS Viral Hepatitis STIs Control Program, NASCAP, the National Agency for the Control of AIDS, Global Fund, the National CSO Coalition on PrEP, Clinton Health Associate Initiative, Clinton Health Access Initiative, CHAI, I can see them. All our partners, communities, and advocates who have worked tirelessly to make this moment possible. This journey has been a long journey, introducing LEN amidst a shifting landscape of the communities we serve. At Root to Rise, we are proud to stand alongside Nigeria in celebrating this great milestone. Through our collaboration and with support from the Elton John AIDS Foundation, AVAC, and the Gates Foundation, we have supported policy updates, we have supported program design and documentation of critical lessons that will shape not just this rollout, but the future of HIV prevention. We are actually writing the future now, so let's clap for ourselves in the hall. Lenacapavir represents more than a new prevention option. It represents choice, dignity, and progress. And while today marks a significant milestone, here is my call to action to everybody. We are called forward to ensure that this innovation actually gets to the hands of the people who need them the most. We need to ensure sustained demand through community engagement, community-led demand generation, and community-supported delivery of this product. And we also need to ensure that we strengthen our health systems to be ready to deliver at scale. We are introducing it through a phased rollout, but we also have to prepare to deliver at scale. At Root to Rise, we are proud of how far we have come together, and we are even more proud to continue to walk this journey with the government of Nigeria and the Federal Ministry of Health. Thank you, and we look forward to the exciting milestones to come. Thank you.
And with that goodwill message from the Nigeria project lead for Root to Rise, that brings it to an end, the goodwill messages for this event. Can we give them all a round of applause, please? And celebrate our partners, implementing and funding partners, the development partners. Thank you for all that you do. The Honorable Minister, ladies and gentlemen, the next items on our agenda are not just speeches, they're not just a response. They're a shift in the gear for Nigeria as we take a look at accountability and innovation at this launch. You will understand when these people come up to speak. I have the singular privilege and honor to welcome to deliver the opening remarks for this event, the Permanent Secretary for the Federal Ministry of Health and Social Welfare. Let's welcome Madam Kachalom Daju, MNI. You can make that applause louder.
Thank you, Dr. Sambo. Always a pleasure. My indefatigable Ministers for Health, Professor Mohammed Ali Pate, CON, and my Minister of State, Dr. Isiaq Adekunle Salako, my brother and colleague, Permanent Secretary, Federal Ministry, not Federal Ministry, I beg your pardon, Federal Civil Service Commission, Dr. Emeka Vitalis Obi, MNI, a doctor by training, an administrator, even though not under Federal Ministry of Health. The DG NACA, all the directors of the ministries, departments, and agencies here present, our development partners, implementing partners, Dr. Dakum, I see you, thank you, my brother. The stakeholders, distinguished ladies and gentlemen, members of the press. Honorable Coordinating Minister, please permit me a minute to just correct something that normally we do wrong. At the beginning of ministerial programs, we are not expected to sing the 3 stanzas of the national anthem, so that the Federal Ministry of Health is not called to account. Please note, only the first stanza of the anthem is either sung or recited. The third stanza should be recited as the national prayer. The 3 stanzas are only recited when the President of the Federal Republic of Nigeria is in attendance. And the national prayer or national pledge can be recited at the end of any event. I just said, let me bring that to the attention of all of us who are here. Now I'll go straight to my opening remarks. It is my pleasure to stand before you all at this ministerial press briefing as we commemorate the 2026 World Tuberculosis Day. Today's gathering is more than a ceremonial observance. It marks 2 significant milestones in Nigeria's public health response: the national launch of Lenacapavir, or LEN for short, for HIV prevention, and the unveiling of the multi-sectoral accountability framework for TB application. This event serves as a reminder of our collective responsibility to confront 2 of the most persistent public health challenges of our time: tuberculosis and HIV/AIDS. These diseases continue to affect millions globally, and Nigeria remains committed to leading with evidence-based policies, innovation, and strong partnerships to reduce this burden. The theme for this year, Yes, We Can, led by the Federal Ministry of Health, powered by communities, is more than a slogan. It reinforces the urgency of accelerating our efforts to end TB. We have made notable progress, and we must acknowledge that more work lies ahead. Strengthening surveillance, improving access to diagnosis and treatment, and ensuring that no one is left behind, central to our national TB response. Distinguished ladies and gentlemen, equally significant is the official launch of the Lenacapavir, a groundbreaking advancement in HIV prevention. This long-acting injectable offers new hope, particularly for populations at higher risk, and aligns with our national strategy to expand prevention options, reduce new infections, and move closer to achieving epidemic control. The introduction of LEN in Nigeria demonstrates what is possible when science, policy, and partnership converge with a shared vision. In alignment with this year's theme, the Federal Ministry of Health reaffirms its commitment to strengthening national leadership
by significantly increasing domestic funding for HIV and TB programs, I beg your pardon, thereby reducing reliance on donor support. We are also committed to fostering community and citizen ownership by scaling up TB and HIV screening initiatives through community-based organizations and faith-based groups. Ladies and gentlemen, Nigeria has made significant progress in case detection and treatment, and these achievements are a testament to three vital groups. One, our partners for their steadfast commitment. Two, our frontline health workers for their unwavering dedication. And thirdly, the people living with HIV and TB survivors for their courage and resilience throughout their recovery journeys. I want to express my sincere appreciation to our development partners, civil society organizations, healthcare workers, and the media for your unwavering support. Your contributions continue to strengthen our health system and amplify our progress. As we proceed with today's briefing, may I encourage us all to reflect on the significance of these milestones and recommit ourselves to building a healthier and more resilient Nigeria. Once again, I warmly welcome us all and thank you for joining us on this important occasion as we, as Federal Ministry of Health, continue to save lives, reduce both physical and financial pain, and produce health for all Nigerians. Thank you for your kind attention.
I think the Permanent Secretary from the Federal Ministry of Health deserves another round of applause. Thank you so much, ma'am. Thank you. All right. I'd like to welcome someone who I have officially made my big uncle, because where he's coming from, funding is their watchword. You know, we all need funds, right? So please help me welcome the leading global fund team, the man who is leading them, John Thomas Lobosi, for his remarks. He had to school me on how to pronounce his name. Thank you for that.
Honorable Coordinating Minister for Health and Social Welfare, Minister of State of Health and Social Welfare, Permanent Secretary, Secretaries, ladies and gentlemen, let me stand on the existing protocol. As a Global Fund representative, I will tell you I'm very, very proud to witness this dual celebration. This is not just a coincidence. It's a commitment, a sign of commitment for integration. Having the TB World Day celebration and the launch, the official flag off of Lenacapavir, we don't consider it as just a coincidence. Honorable Minister, we thank you for your leadership. We thank NASCAP, NACA. Today's ceremony, we thank also all the partners, including the media, everybody here, because today's ceremony is another demonstration of the Global Fund partnership. The Global Fund is about partnering with government, civil society, private sector, communities to fight against the three diseases. So the deployment of Lenacapavir today represents one of the key milestones of the Global Fund Strategy 2023-2028 that commit to accelerating the deployment of new tools and promoting access, equitable access. So it has been said, Lenacapavir represents a game changer, but not only a game changer, it's really a major advance to the prevention of HIV, because as you know, it addresses one of the key challenges in the prevention of HIV, which was the difficulty for adherence to a daily HIV plan. So it's offering really a hope for reaching the population that we have not been able to reach because of all these challenges. And for the first time, since the beginning of HIV pandemic, a new tool will be rolled out at the same time in developing countries and in the Western countries. Lenacapavir is launched in the whole country at the same time. And I think we need to recognize this. The Global Fund ambition is to reach 2 million people with Lenacapavir by the end of 2028, working with partners with 9 early adopters countries, and of course, Nigeria is part of the 9 adopter countries. Nigeria will receive by 2028 179,700 doses. And as it has been said, it will be launched in 8 states of Nigeria. So the Global Fund support is just catalytic. And we expect, Honorable Minister, that the government will step in and accelerate the deployment to the whole country. Now on TB. TB, Nigeria has achieved very impressive results in the fight against TB. Treatment coverage increased from 100,000 cases in 2019 to 458 cases in 2025. And the treatment coverage reaches 90%, with the majority of TB cases successfully treated. This is really a high-performing program, one of the highest performing programs supported by the Global Fund. This achievement has been made possible by the fact that the country is a pioneer in adopting and rolling out new technologies, innovation, and it has been said here. While the Global Fund remains a committed partner, ending TB depends on really a strong commitment, strong ownership of the country, and the sustainability remain in the hands of the country. The government financing commitment, we expect Honorable Coordinating Minister will be fully realized. We expect that in the coming years, there will be no interruption in the TB funding, no interruption as we risk to reverse all this progress. So with the sustained investment, the strengthening of the system and the continued innovation, Nigeria can say yes, ending TB is possible. Thank you so much.
I know we can appreciate Mr. Jean Thomas Nobosi leading the Global Funds team here and underscoring to our honorable ministers what it requires. Ending TB requires strong commitment. Thank you so much, sir, for your moving remarks right here at the World TB Day commemoration and the launch of the multi-sectoral accountability framework for TB. All right, distinguished guests, ladies and gentlemen, I already told us that the next set of items are a shift towards innovation and accountability. Just before I invite the ministers, I would like us to introduce the multi-sectoral accountability framework. And I'd like to welcome from the National TB, Leprosy and Borreliosis Control Program, Dr. Obioma Akaniro, to come quickly. Yes, please encourage her. Thank you. To come quickly to just introduce the MAF before the minister comes up.
Thank you so much. I'll just take 2 minutes. The Honorable Coordinating Minister of Health, the Minister of State, please let me stand on the already existing protocol. I'll just take you through the MAF framework. Next slide, please. So the WHO introduced the multi-sectoral accountability framework, and the reason was basically because a whole lot of the drivers for TB are within or outside the TB control, things like nutrition, poor housing, and a lot others. Next slide, please. So based on it, they need to have a way for the stakeholders to come together in the plan to eliminate TB was put in place. Next slide, please. Next slide. So Nigeria went ahead to adopt and introduced and developed the multi-sectoral accountability framework together with other ministries, departments, and agencies. This is the book with ISBN number, which the Honorable Minister will be launching today. Next slide, please. So we went ahead also to introduce some innovation to become the first country to develop or roll out our MAF in an application. So right now we have an application which we have slogan, TB MAF, your role on a click. That means that even if you forget the books, you will still have the application in your phone to assess what your roles are. Next slide, please. So in line with that, we have attached it to throw TB out of Nigeria. I know if you're coming, when you were coming in, you would have seen a basketball court where you can go and just make a dunk, throwing TB out of Nigeria. And that's just a commitment with our partners to show what we are working towards now. Next slide, please. So you can go to our website. On getting to our website, you just click MAF. And when you head to MAF, you will still download and install. Once you install it, it loads all the MDAs, and with that, in clicking, it will show you can access your roles within it. And it's nice to note that the logo of MAF for TB program in Nigeria is showing hands. These are live hands that have been animated, which gives us a picture that we are all working together to ensure that we eliminate TB. Next slide, please. Next slide, please. So this is just a description of how to download it. So I just expect you to go to your website, to our website, ntblcp.org, and identify MAF and start downloading. Thank you so much.
Thank you very much, Dr. Obioma Akaniro from the National TB and Leprosy and Borreliosis Control Program, giving us a guide on how to download the app and to use it. I don't think we caught that because I didn't hear an applause. It's not just a book we're launching an application. Please, a round of applause for Nigeria. Thank you, thank you, thank you, thank you. All right, the Honorable Minister, At this point in time, we shall be taking an address by the Honorable Minister of State for Health and Social Welfare. Let's welcome him, Dr. Isiaq Adekunle Salako. Please, a round of applause for him.
Please, let's sit down. Thank you very much. The Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, Permanent Secretary, and I'll repeat permanent, not secretary, because that is really the important part of it. Permanent Secretary, Federal Ministry of Health and Social Welfare, Daju Kachalom, MNI, and my dear brother from the Federal Civil Service Commission, Permanent Secretary. Thank you very much for joining us. Directors, let me use the Director of Public Health to salute all our directors here present, Director General Naka, all our distinguished partners, WHO, UNICEF, Global Fund, IHVN, and of course, the very important network represented here by NEPON and others. Gentlemen of the press, distinguished ladies and gentlemen, when John Thomas was speaking and he spoke about this not being a coincidence, I want to reaffirm that there are not many events that you see the coordinating minister, the Minister of State, and the Permanent Secretary seated. It's more or less that the Federal Minister of Health has been moved 100% to TB and HIV. And I think this underscores the very key importance that all of us attach to these very important public health issues of ensuring that we eliminate TB and HIV from our territory as a public health threat by 2030. And IHVN spoke about the distribution of condom using very innovative mechanisms. And it brought to my mind the story of a young man who went to buy condom in a pharmacy, and it was demonstrated using a finger. And when he got home, he also used the finger rather than. And so I was wondering whether nobody opened that condom to taste it because you distributed with sweets. So today, we join the global community in Nigeria to commemorate the World TB Day 2026 and also launch Lenacapavir, mouthful, so I'll continue to call it LEN, for HIV prevention, and also unveil the multi-sectoral accountability framework for TB application. This convergence reflects an intentional shift towards a health system that is innovative, integrated, and accountable. Under the leadership of President Bola Ahmed Tinubu, GCFR, and driven by the Nigeria Health Sector Renewal Investment Initiative, Nigeria is transitioning from fragmented, donor-dependent silos to coordinated sector-wide approach that ensures that all available resources are aligned behind national priorities to deliver measurable impact. Through the Nigeria Health Sector Renewal Investment Initiative framework, we are prioritizing integration of TB and HIV services across all levels of care in alignment with partners' support and our national systems and priorities, strengthening accountability, and using tools like MAF-TB and providing sustainable financing to ensure TB and HIV services are free at the point of care. It is heartwarming that our TB response has achieved a historic milestone with case notifications surging from 138,591 in 2020 to 440,000 in 2025, the highest ever recorded in Nigeria. This achievement is the result of strategically expanding our diagnostic networks, especially our Gene Expert Network, which increased from 32 machines in 2012 to 527 today. While TB True NAT capacity
also grew from 39 units in 2013 to 372 as at today. Treatment success also remained high at 94%, reflecting the dedication of our health workforce and the efficacy of TB medicines. Yet, thousands of cases remain undiagnosed, highlighting the need for continued innovation, expanded access, and domestic financing. Similarly, in the last 3 years, up to the end of 2025, the performance of the HIV response, with focus on UNAIDS 95, have achieved 93% of people living with HIV knowing their HIV status, 99% of people who know their status are receiving sustained antiretroviral therapy, and 95% of people receiving ART are virally suppressed. PMTCT coverage has also improved from 33% at the start of 2023 to close to 70% at the end of 2025. As we continue to progress in achieving epidemic control, the need to intensify prevention strategies to sustain the gains through innovative, accessible, and scalable methods such as LEN PrEP remains critical. The launch today of Lenacapavir, a long-acting injectable PrEP administered twice yearly, represents a transformative advance in HIV prevention. It offers high efficacy, discretion, and convenience, especially for individuals who face stigma, mobility challenges, or difficulty adhering to daily oral medications. Similarly, the MAP-TB application will strengthen accountability and multi-sectorial coordination by enabling real-time tracking of commitments, ensuring all stakeholders, including government, partners, and communities, are aligned in delivering results. I want to commend our partners, the Global Fund, the United States government through the Department of State, UN agencies like UNAID, WHO, UNICEF, and other development partners, and our community stakeholders for their unwavering support and collaboration. To end TB and HIV, my call to all stakeholders is to continue to institutionalize TB and HIV within all health implementation frameworks so that we can spend smarter, implement sustainably, and impact at scale. Let me assure you that TB and HIV care are essential components of our universal coverage agenda that the federal government is committed to its sustainable funding. I invite our cherished health workers to continue displaying professionalism and dedication, which are critical to the success of these interventions. And to our communities, civil society, and traditional leaders, we will continue to count on your trust, advocacy, and engagement as essential elements to get to the unreached and to combat stigma. Together, through innovation, integration, and accountability, we can accelerate progress towards ending HIV and tuberculosis as public health threats. Let today's launches of Lenacapavir and MAP-TB therefore signal Nigeria's leadership in adopting scientific breakthroughs, strengthening systems, and building a healthier, more resilient nation. My message to every Nigerian is simple. If you have a cough that lasts for 2 weeks or more, do not wait. Visit the nearest health facility, get tested, and get treated. The ABC of HIV prevention, which is abstinence, avoiding risky prevention behaviors, being mutually faithful, and consistent condom use, are still very, very important, and they remain the key for HIV prevention. If you know you are at risk of HIV, get tested. If your result shows you are positive, ensure the immediate commencement of treatment in a health facility with high-active antiretroviral therapy. And if you are negative, but at risk of getting infected, commence the use of oral preventive medications or injections for PrEP, such as captogavril and the newly launched Lenacapavir under appropriate medical guidance. Distinguished ladies and gentlemen, want me to dedicate and recommit by echoing, yes, we can end TB and end HIV. Together, let us join hands to ensure that every Nigerian has the opportunity to live a healthy and productive life free of preventive diseases like TB and HIV. And so, with peace and plenty, Nigeria shall be blessed. Thank you.
Another warm round of applause for the Honorable Minister of State, Health and Social Welfare. Well captured there. Thank you so much. And at this point, let me appreciate the Federal Ministry of Health and Social Welfare for the commitment they have consistently demonstrated under the leadership of His Excellency, the President of the Federal Republic of Nigeria. We're talking about walking the talk, and walking the talk comes with action. It comes with urgency. It comes with consistency. It comes with sustainability plan. It comes with a lot of doggedness, and it comes with accountability, of course, and transparency. And we're seeing a shift in the health sector going by the renewed vigor under the renewed hope. Once again, let's appreciate the Ministry of Health and Social Welfare. And at this point, if you check your agenda, you know the ministerial press briefing is just right about time for that. And please, let's be upstanding as we welcome the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON.
My dear brother, the Honorable Minister of State for Health and Social Welfare, Dr. Salako, the Iron Lady of the Federal Ministry of Health, Permanent Secretary, Madam Daju Kachalam MNI, and the Permanent Secretary, Dr. Emeka Fidelis Obi, at the Federal Civil Service Commission, heads of agencies, directors in the Federal Ministry of Health, our esteemed development partners, WHO, UNICEF, the Global Fund, very generous partner, Dr. John Thomas, and IHVN, Dr. Dakum, NEF1, all other protocols duly and respectfully observed. I think a lot has been said, so it's not for me to give a very long speech. If I were to give a speech, I would say the speech that was given by my colleague, I think suffices. I think building on what the Permanent Secretary has already stated. I would like to commend the Department of Public Health of the Ministry, NASCAP, and the TB program, as well as NACA and the Global Fund, and all our partners for coming together around this agenda. Whether it's celebrating the World TB Day, or the MAF-TB framework, or the launching of this innovative instrument in our fight against HIV, to do so in such a fantastic way. So thank you for all the great work that you have been doing. I think over the last 2.5 years, all of us know that we're in a world that is far different from where we have been 10, 15 years ago in this fight. The global space is changing right in front of our eyes. We deal with multiple crises all the time. Financing has become limited globally, but also constrained in many countries, including our own country. In such times, it's innovations that will allow us to get ahead of the challenges. While we've had tremendous success in dealing with HIV, TB, malaria over the last 25 years, thanks to the global partnerships like the Global Fund and Gavi and many others and the multilateral partners, the headwinds we're facing now in terms of the changing global landscape forces us to think differently. Of course, there are innovative tools like Lenacapavir, which is coming to give us another instrument that can help us finish the work that we know we can be able to do. But at the country level, in Nigeria, under the leadership of His Excellency President, We, in a way, anticipated, I wouldn't say exactly anticipated, but whatever it is, the president's vision for us to defragment the sector, to put national ownership, government leadership, but in a multi-stakeholder manner, bringing all actors together so that the responsibility lies on the sovereign, I think is proving to be very apt, given the changes that we're seeing in the global landscape, where we improve the efficiency, use the resources that we have, use them well, but also effectively make sure they deliver what they are supposed to deliver. So the integration point is really on the issue of efficiency as well as effectiveness, because as long as we avoid working in silos, we can stretch the limited resources to get us far in terms of achieving the results. So under the sector-wide program, I think we've begun to see progress in many dimensions. And on HIV, TB, and I'll add malaria and other diseases, we're committed to continuing to work on this path. And with the support of our partners like the Global Fund and all the technical partners are here, I assure you that the government, we not only demonstrate, but we end these 3 diseases. It is possible, and yes, we can. I would like to say something about the co-financing question. I think NEF1 asked, and in the spirit of just openness, transparency, and constructive partnership, I would say that the approach we took to bring different levels of government together, federal government, state, local governments, external partners, for Nigerian health system to operate as a national health system. The fiscally decentralized system we have transfers resources to federal government and to states and local governments. And we need to work hand in hand at all levels of government. That is the path that we need to take. And so when you talk about counterpart funding, in the past, counterpart funding, everybody will come for their own little pot of money that they want to counterpart funding. 10%, 5%, this amount, this amount. It's a fragmented approach. What we have now tried to shift is to have a coherent approach whereby the program and government's resources overall are co-financing the entire effort. So when you look at Nigeria's health spending, less than 10% is externally financed. More than 90% is domestically financed by public sector or by private sector households contributing. So that's, it gets missing. The bulk of the progress that has been made, even globally, was driven by domestic financing, even though the attention tends to be on the external financing. The external financing is the icing in the cake. It's more catalytic, more flexible, more innovative, and it buys commodities, but it's a lot of resource that is being channeled in the personnel, in the human resources at the federal level, state level, that also counts as part of the health spend. So in the context of the conversations we've been having with one of the major bilateral funders, in terms of the exit, we want to exit dependency over time. By 2030, Nigeria should be able to put its own domestic resources towards the priority diseases that afflict its people, so that it's not out there consistently looking for this grant or that grant. The only way that will happen is if Nigeria puts its own money where it matters for the health sector, and that is federal government, states, local government. Otherwise, we'll continue to be begging John Thomas to give us more money, and we don't want to do that. And so with this major bilateral funder, we agreed that as they scale down, we increase domestic contribution in the federal budget, but also states should do that. Not only the allocation, but the point that the JT made is the release to make sure that it's available. That has been a challenge, but that is what we're trying to fix. And if we're silent about it, then it happens. So all of us have a responsibility to ensure that we allocate, but we ensure that it's also released. In the context of this major bilateral funder, I'm just pleased to say that the co-financing for 2026 in relation to this large program, which supports HIV, TB, malaria, and other strategic investments, is almost $346 million additional. And His Excellency President has already directed the Budget Office of the Federation to ensure that it's captured in 2026 budget. That means that some of the commodity costs, the laboratory surveillance costs, the reagents, primary healthcare, expansion of financial protection should be included. And that budget is on the way. We hope that it will be concluded in a way that ensures that it is there as directed by the President. So you and all of us, the civil society, that's where you need to step up to ensure that, in fact, in the appropriation process, the voices of Nigerians is felt. And when those resources are appropriated, to ensure that, in fact, it is released. For tuberculosis, I know that we have been struggling over the last several months in terms of where to procure to ensure that we preempt the stockouts. This will be the largest, more than 50 times what we had ever really put in financing TB commodities that were put in here. And so the procurement process is one that has to be done very carefully, that also takes into account the delivery timeline so that we can be able to get it. All in all, to say that federal government under President Tinubu is committed to ensuring that we meet our commitments. We have the political leadership at the highest levels. Her Excellency Senator Remi Tinubu is a global TB champion, not only here in Nigeria, but in Africa and globally. And her voice has reverberated, building on the success that Nigeria has already demonstrated. And so there is no question in terms of Nigeria's commitment to continue the fight on tuberculosis. So as we launch this instrument, I hope it will only allow us to double our commitments, triple it, multiply it in many folds to ensure that we end TB and we end HIV, because we now have the tools that will get us closer. So once again, thank you very much. And I declare this, all these instruments launched. I think that's what I'm supposed to do. Thank you. Okay. Okay. Very good. Minister.
Appreciate the coordinating Minister of Health and Social Welfare once again.
Please give him another round of applause, a loud one if you may, as he makes his way to launch the multi-sectoral accountability framework for TB, as well as the LEN PrEP. They're going to be unveiling it. The Honorable Ministers, alongside other dignitaries with them, would be unveiling it, and they will be witnessing the administration of the very first jab of the LEN PrEP.
And please, let's try not to crowd the place. Just development partners, the two ministers, of course, the PAMSEC, and the two national coordinators, NACA. Please, let's step backwards, please, so we don't crowd the place, please.
A round of applause, please. The Honorable Minister has snapped the ribbon. Please clap.
And that's the launch of the multi-sectoral accountability framework. With the launch of this framework, of course, with coordinated approach, we will look forward to effective implementation of the framework. Please, another round of applause.
After the photo op session, we will witness the launch of the LEN PrEP. And then the LEN PrEP is about to be unveiled. And then we shall be witnessing the first the administration of the first jab of Lenacapavir.
Please,
A round
let's
of
try to
applause.
create room for the media team so they can get good shots. And there you have it, the launch of the Lenacapavir. A round of applause for this milestone to record it today.
And they're taking photos right now. After this session, the Honorable Minister will be tossing TB out of Nigeria at the basketball hoop and in the lobby. You'll be tossing TB out of Nigeria in the basketball, yes, at the basketball hoop in the
That
lobby
will be
area.
on your way out, Honorable Minister, not immediately. We're not done. We have to have photo session.
I would invite the Honorable Minister to come. Let's take a photo session right here in front of the stage, alongside other members of other dignitaries that are here. Can we move it, Sultan? So are we doing it?
WHO, Director of Public Health, the Permanent Secretary, the two Permanent Secretaries here, UNAIDS, Global Fund, NACA,
We're inviting all the critical stakeholders to kindly join the Honorable Coordinating Minister.
Please just key partners for now. Thank you. All right, so for the jab, made to understand that will be taken outside the hall. So, but we have to get back to our seats with your kind permission, distinguished guests. Let's get back to our seats. Please, we still have the vote of thanks. We still have the national anthem. So please, let's get back to our seats.
So don't worry about it. Don't worry.
So the Honorable Minister is still here. Honorable Minister of State, sir.
So please.
Yes, we would like to close up.
With your kind permission, let's be seated for the vote of thanks. The jab, the demonstration of the first jab of Lenacapavir will be done outside the hall. And of course, throwing of the ball to end TB will be done outside the hall. So let's wrap up formally. Then we can have all that demonstration done outside the hall. Thank you for your cooperation. Please, let's get settled. We're not done.
Please, can we be seated?
Can we get settled, please? Thank you.
Would like to take the vote of thanks to bring this event to a close. I'd like to welcome the acting national coordinator for the National TB and Leprosy and Borrelia Ulcer Control Program, Dr. Clement Desigbe, to come give us the first part of the vote of thanks. Please clap for him as he comes.
I will be having 2 vote of thanks, just for your notification. Thank you.
Good afternoon, everyone. The Honorable Coordinating Minister of Health and Social Welfare, the Honorable State Ministers of Health and Social Welfare, my Permanent Secretary, my DPH, I say good afternoon to everyone. For me, it's really an emotional time. I think this is a very big event for us, where we see all the biggest players in tuberculosis, in HIV, under the same roof. We have not seen it like this. So I think we need to give a round of applause to all the leaders in the Federal Ministry of Health. Let's really celebrate them. And for me, anytime I get to a place, I want to learn. And when I came in, somebody across me and said, we enter into this vicinity and we've seen posters and all of that. We've seen some presence of HIV, B-boys and all of that. And we hardly could see that of TB. I said, you need to come inside, then you see a lot of presence of TB. And I said, these are some of the lessons and some of the challenges of integration. I said, for us, HIV is the wife. And as husband, you need to tolerate your wife. If you have to have peace at home. So it's a lot of lessons for us. And one of the things that the Honorable Coordinating Minister used to tell us is there must be value for money. He always emphasized that. And so this is the way to go. We have to integrate. My task is really to thank everyone. I want to thank our leaders in the Federal Ministry of Health. We really appreciate this. We want to thank all our partners, development partners, the funders, TB survivors, NEP1, the press. We thank you so much for making this a date with us. For me, the work has just started. Yes, we have been able to maybe kill two birds with one stone, but we just started the race. There is a lot of work to do. Like people have said, TB has done a lot of work. There have been a lot of case finding, TB coverage, and so on and so forth. But sustaining that can be very, very challenging. And if you look at the NTB strategy, it tells that in the last phase of this NTB strategy, innovations are very important. And Nigeria has been very good at taking up innovations. But we must not rest on our oars. We need to deploy these tools. We must not remember, and we must not forget that. We need to deploy those tools. We need to implement. And that's where the work is. So I really want to implore all of us to support us so that we can properly deploy these tools, the LEN PrEP and the MAF-TB. We need to deploy them and ensure that we can implement them. I want to thank everyone and safe journey to your different places, and God bless.
Thank you very much, the Acting National Coordinator for the National TB Leprosy and Borrelia Ulcer Control Program, as he has delivered the vote of thanks at this event. Honorable Minister, distinguished guests, ladies and gentlemen, everything that has a beginning, unfortunately, has an end. We have a press briefing as well as the official launch of the multi-sectoral accountability framework for TB and the launch of the LEN PrEP for HIV. Ruth, it's been an interesting experience, hasn't it?
Indeed, and hearing the stakeholders, commit to advance in the course, to ensure that Nigeria kicks out TB and, of course, end HIV by 2030. It says a lot of who we are as a people. Well done.
Yes, and we shall be seeing the Honorable Minister as he kicks out TB, a symbolic act happening right outside this hall in the lobby area. He'll be tossing a ball into a basketball hoop. This will be one to make for lots of views on social media. I'll encourage everybody to be a part of that.
And we'll also see the demonstration of the first jab of the LEN PrEP. I don't know who the volunteer will be. I don't want to know. but I know there is. All right, so we want to say congratulations to Nigeria at this point, and we want to thank all our partners, of course, partners in progress, and of course, the coordinator for the wife of TB. Thank you, sir. Thank you. All right.
Please, a round of applause, please. If you want to clap, clap there.
All right.
It's been an absolute pleasure being your host this beautiful afternoon. Do remember, my name is His Royal Highness, Africa's finest MC. You can find me on Instagram at HRHSambo. Let's all rise. Please,
As
Ruth.
we take the national anthem. Let's take the national. Just the fourth stanza, please.
The national pledge.
Okay, let's take the pledge.
Okay, national pledge. 3,
If you
2,
don't
1.
know it, it's okay. Okay.
Pledge.
Not that one.
Yes, that's the pledge. That's the
Okay,
pledge.
okay.
3, 2, 1, go. I pledge to Nigeria, my country, to be faithful, loyal, and honest. To serve Nigeria with all my strength, to defend her unity and uphold her honor and glory. So help me God.
Thank you, and God
Thank you
bless
very
the
much.
Federal Republic of Nigeria. Wow. Thank you so much. Thank you.
It's over. My goodness.
Yeah.